O te whatalo whātu mano o whaaloalo whawhonganga ale atumu o nei tū la. Whatasi mai tato pot whasala lau le ngatari Professor Graham Lacroix. Ia e whape nā male Head of Communication po le fo i olowa aiala tonga luenga fsota inga I tu tonu ntanga luenga ale Malaghan Institute of Medical Research. Te alofa, good morning. Welcome back to Samoa Capital Radio.
Thank you for inviting us back. It's lovely to feel the warmth and the love.
Thank you. Gail, it's good for you to come in front with us. No, but it's good because for the information of the listeners, Gail is the person that I liaise with to try and make time for Graham to come and talk to you on Samoa Capital Radio. So thank you for coming and joining us this morning. Perhaps if you wouldn't mind talking a little bit about your role in the organisation.
Yeah, so I'm part of the communications team, and our job is to try and share the great research that's going on at the Institute so that members of the public can understand it better and really get a handle on why we're doing this research and how we're trying to help New Zealanders and the wider population. So I work really closely with the scientists, with Graham, to help to understand what active research they're doing, and when it's at a point that it's ready to share, then we work out on the best way of getting it out. We've got lots of different ways we do that through our own channels, the website, social media, but also through the news media and other comms channels.
Very good. So you're a well-learned person within the organisation from what the scientists tell you.
I'm the non-scientist in the comms team, so I've got two science communicators who get the science a bit better, and I'm the one that says, so what, why does it matter?
Yes.
And help translate that for the public.
Layman's talk.
Yeah, and that's important. So,
But also very important because sometimes when you're dealing with the media and journalists, Gail can crack the whip and sort of get some control, because sometimes people make stories which aren't what we're trying to say, and Gail's very good at keeping everything on message so it doesn't misinform people.
She's been very kind to me when I read you, which is very good. All right, let's have a look at some of the things. And Graham, how have you been keeping?
Well, I've been fully boosted and vaccinated, so I've escaped COVID. It's been very good, but I have to say, very, very concerned with just all the people out there, cost of living crisis, and just realising post-COVID, the impact on our society, and everyone out there listening, just how hard it is to make ends meet at the moment. And I hope that we see the country pick up speed, the economy starts to improve again, because people need jobs, and they need to be paid well, because it's a tough place. And I'm just feeling for people as we go into Christmas. I'm just thinking of them.
Well, we just got a new government, but we won't talk much about it because they only just started.
Yeah. But we're watching them.
Yes. Graham, if I could take you back to our program back in July 22.
Yeah.
There was an earlier program from that where there was a discussion of the research work being done at your research institute. Perhaps tell us what's been happening since.
Okay. Well, just to take you back to July 2022, we were asked by the government to lead and build a New Zealand Kiwi-Vax for COVID-19. At the time, the government didn't know whether the Pfizer vaccine, the Moderna vaccine would work, and they were very keen to have a local homegrown one made, just in case. We have made that vaccine. It's a really good vaccine. We've tested it now. We've taken through all the testing stages. Of course, we're a little bit later than the Pfizer vaccine. We didn't get the billions of dollars to make it work. But we're in a good situation that we're now doing a manufacturing scale up, and we're looking to test it in humans and do a clinical trial phase 1 safety study next year. And that will actually mean and give the government great comfort that we actually can make a vaccine against any virus or whatever here in New Zealand. And the good thing is if it passes our safety study, that means we'll be able to start talking to people about offering it to and manufacturing it and distributing it with a company to help us to be a booster vaccine for COVID.
Can the government here sell obviously your IP will be, so you can make money out of that?
Yes, but we're a charity, so we're not out to make money, but we would do a deal with a company that would like to, who knows how to make vaccines regularly and make millions and millions of doses and distribute them, because putting them on ships and all that is quite tricky. So we would like to do a partnership with a company that would then do that. Of course, we'd like to control the costs for the New Zealand, certainly for the New Zealanders, because they've helped pay for it. But we're very keen to take this as far as we can. So we haven't gone away. We've made our vaccine. It's a good vaccine. It's better than Pfizer. And we're looking forward to actually seeing if we can get it out there as a booster. Because one of the good things is it's stable at room temperature. It doesn't need the minus 70 freezers. It's made the old traditional way. And it can has some advantages, as we know, out in the regions which are haven't got the infrastructure and specialist facilities for storing.
So you've gone through phase 1 of the trials, is that correct?
No, we're just looking at phase 1 early next year.
Yeah. All right. Let me try and give some Samoan.
Yes, sorry. Yeah.
Ole to whaafonga mai to sisila mai o tō lunga o tato a whasisilanga le tai o nei lunga wala ata ia o lo mato whaatasi re ngata i Professor Graham e te tanoi i mta o putai o nei whaatau i tui ma tāpenanga o lo anga i Isus o ngalato a lo whaatasi mai fo ia Gail Marshall i o iolo ta iulu lato whaasala lau mai tono lato o nanga. Ia le tele noe vai temi le tanoanga le lurai lua whenua. Sa matu tele noa i tamu whainga ina ia whaise tui pui i tono New Zealand. Na talo sanga le malo i le paenga nei ina ia lato ngausia se tui. O le ala o le tūlanga o susuenga o mawhai e lato o na whaile tui lea. A le ala am whaina whaile sila asanga o le whaataita in tangata so i fua i tono New Zealand. Ia o nā ngā ia tūlole o nisi i vaenga i le mole anga i lunga o le tapenanga o le tui nei. You know, we've had the booster, I think they're on number 3 now for vaccine. How long is a booster good for?
Well, the booster is good for a year, we know that.
Right.
Remember, we haven't only had the virus around for a couple of years.
Correct.
And I should say, it's good, that booster. Everyone should get it, because it just gives you such great immunity for the moment. But every year you get it at the moment.
But also important to note, and Graham's big on this, is that there is still room for a lot of improvement with vaccines. So we're looking at making something that's longer lasting, that's more effective, so that people aren't having to consider getting it on an annual basis. Yeah,
and what I like is a vaccine where I only have one jab, instead of having 2 different jabs, one for the flu and one for COVID.
And also, people are working on not doing the jab, just having something that you can either rub on or spray. There's some other tricks being developed, and so not by us, but other groups, but we're watching that space very closely, because not everyone likes a jab.
Yes, some people get so many jabs that they want to minimize that. The JN1 that's circulating now started off in the US, I believe, second week of this month. And it's hitting us?
Yes. No, it's amongst the COVID viruses that are infecting people. JN1 is now becoming the dominant strain. It's spreading everywhere. India, America, or the US. The symptoms and the severity is no different from the previous strains. Right. It's a form of Omicron, actually. It's just got trickier at escaping a little bit the immune system. It's got a little bit more subtle. So one reason why it can spread is that because people don't know quite they're infected, and it's leaking out virus before they are aware they're infected, and that is how it spreads to other people, and then only then do they start to get the symptoms. So it's a clever little virus that's trying to survive.
Second week of November, I came down with the symptoms of the flu, and the first thing I did was test me for COVID, and it was negative, and I thought that'd be all right, and then 3 days down, and I thought, this is getting a bit not my norm. So I saw the doctor, and he gave me antibiotics, and I thought, must be serious if I. But after that, I came right, and then I thought, but when I saw the doctor, he said, let's test you for COVID, and it was negative again. He said, oh well, that proved my first test. So those are the things people ought to take care of when they come down. They should take the test.
Take the test, because then you know what you're dealing with. And it helps the doctor, because they don't. Something else can happen, because there are other viruses, other bacteria around which we have to guard against. And if you've got diabetes of any kind, it means you're quite vulnerable to respiratory infections. So you've got to be careful.
you ended up with a succession of variants. You know, if I look at, we start with COVID-19 and then a BA something.
Yeah, A and B, and then Delta. Yeah, then Omicron came around.
Yes, and now we got this JN, and I think we're going to go through all the alphabet, and you run out of the letters.
We'll go to all the other alphabets.
And you start adding numbers and things.
Yeah, but one thing I can reassure you, or everyone out there at the moment, the variants aren't really getting any worse. We have been worried for some time that a variant would come along that would be much worse, but it seems as that they can't really get past the immunity which has been generated by the vaccine. So far so good. But it doesn't mean to say you should let yourself be infected. You should actually try to avoid infection.
The problem I see is that you can come up with a vaccine to deal with what is in front of you, and then the variant come up is a bit different from what you were trying to deal with previously.
Yeah,
So how do you keep up?
Well, that is the power of the immune system. Because remember, although the virus tries to change, it cannot change completely. So there's still parts of it that look like the old virus.
Right.
And your immune system can still attack it. So it can never really get too far ahead. And the immune system can always catch up and then make new antibodies to get the new parts of the virus. That's how it works.
And some people get it very badly. You
Yeah.
know, so obviously the immune system is not that.
Yeah, diabetes is a really tough on the immune system,
Okay.
and that's why they get sick. So it would be good to mention that. So if you're suffering from diabetes, take extra special care.
Yeah.
You do need to get a booster. And if you know someone with diabetes, it's important they keep their booster shots up.
Yeah, thank you. O le mataltana no e tūlanga o tō ai ngā vaenga e o le wairusi le la venita tō amata mai le COVID, Delta, Omicron, le leo whaso solo mai le wo mai le vaenga le ka o le JN1, le tele na mawai nei, ta tele nei le taimi nei, e sao. O le whautuanga ina ia vaai e whaiwha le tui pui pui, a misi au tau le mo le diabetes po le suka. Awai o tau wha le tonu le tau vaenga o le sulfo maloloina le te te e toi wha mai ese ese. O le mena e tauna pui pui le lei i tātou le mo le suka. Whaia tui pui pui ia ona fo le whiololo le pia a fia le toi ngase ngase lea. In 2021 I discussed with Rob Winco.
Yep.
Yeah, the groundbreaking cancer treatment, CAR T-cell.
Yeah.
So that CAR T-cell, where is that at? Is that what we just...
Yes.
Okay.
This is a new cancer therapy where we've actually found a way, well, scientists around the world have found a way to take a patient's immune cells, put them in a test tube, tune them up a bit and put them back in, and they go to the body and they go and kill the cancer. It's really amazing. And it works really well for certain forms of cancer. At the moment, it only works for blood cancer, but we're working like crazy to see if we can make it work against solid tumours, things like lung cancer, colon cancer, stomach cancer, prostate cancer. Oh, yes.
Yes.
A lot of pressure on the prostate cancer. It's a bit harder to work against solid tumours than the blood cancers at the moment, but there's a lot of tricks yet to be explored. So this is a very exciting new development. We here at the Malaghan Institute are really trying to make the treatment simpler and easier so it comes to the people, and that's our breakthrough.
So right now with this development here, you're on the... Are you just about ready to put it out or treat people or...
We have to go through several stages to convince the health authorities it's safe, it's reliably safe, and also that it can work reliably as well. So we've passed the phase 1 safety study. Now we go to efficacy, what is called efficacy study, and we try and show the regulatory authorities that, hey, this works every time the way we say it does, and we tend to treat 60 patients over the next 2 years of this horrible blood cancer. And they're from all walks of life, all people. This cancer does not discriminate. It just gets anyone. Young people,
Yes.
Middle-aged people.
But that's being used
So I was
in
just
other
going to
countries.
add that we published our results at
Yes.
the beginning of November, and the key things from that were that it was safer than other commercial therapies that are currently on the market. So and also showing good signs of effectiveness. So I think it was half of participants on the trial had no cancer in their system after 3
Right.
months.
Yeah.
And these are people right at the end of their journey.
It'll be good
With
to
minor
have some of those
occasions.
people come on radio and we can discuss.
It'd be very important to do
Yes.
that, because this is the first time New Zealand has a better treatment for this cancer than anywhere else in the world, safer, and so it's very exciting. So we're really working very hard at the Malaghan Institute to make this happen.
Is this present in some other countries, or are you doing the lead part of?
We've got our own unique version of it,
Right.
and other countries, they're trying to develop this. They've got other versions which don't work quite as effectively as our ones here.
Right. So what's holding you back in getting this out and given to everybody? Is it the money, or is it the legislation, or is it
Money,
efficacy?
legislation, educating the doctors, getting the health system orientated. All this is a lot of work, because it changes the way you treat cancer. Instead of having the patient getting full of chemotherapy and feeling sick, you've got to just bleed them and then do something to their cells and give it back to them. It's a totally different way of treating the cancer.
This is also a new treatment, so we have to go through the necessary trial phases to prove that it's effective and safe.
Yeah.
And that's a really important part of research science.
A lot of people lose their hair when they have chemo.
Not with this one.
Oh, that'd be a seller.
It's a one-off treatment.
Oh, all right. Ole, let me tell the audience. Ole vaenga le matatano iai, sa tatano le lua felusu tasi male scientist sa fatalo tatulitio. E yele nga luengo longa luele ta faingo ole kati sel. Aliela sa yele pepa peon sa unoia ia kei ole masino November na lolom yele ila to pepa. Ia fo I vaenga I wanga I ho yele la to susuenga. Ma ole o le taimi wa taltonu la to wa mo tonu wale me tau na fai New Zealand. A ye si vaenga o tapenanga vai la au matui New Zealand. E anga iai e dene ta ole opule ole efficacy study e lona winga e iai e tangata e tau o na fai Yesu su e ngai onus fu tangata leve a fo mana fai le o mo wa isi e le mo sa fai ne a wo muna fo ina fa to fo il malo si tangata nei mani fo ile no fa tu mani pe mo mo se su tangata se fa tala no lungo tato ale tio a pe o su e ngai o le fai la to tasi ala me ele ngate mo mia mani I tupe e fai ia tele wa tele singa luenga a o ia tangata fo mai fa nganga le tuilia wa ese mai mo le manga le su e fo e tongo fiti nei ka ne se le tele na le lo isi wo to ulo a le tui a le vanga le ese ole o tonu la voltino tangata le fai ia nga luenga ina fai nga ngalu ai le fa pe mai fa fole toto ona suila I o isi vaenga to tono tino. Perhaps if you don't mind if I ask, Graham, can you describe the difference between the treatment that you sort of researching and the normal chemo?
There's a different approach. Normal or current treatment is they try to kill the cancer cells by giving toxic drugs or things that actually kill cells.
Right.
And they try to target as much as possible to the things that a cancer cell is different from our own body. However, most of these drugs also will get the kidneys, get the gut, make the brain. So it's always a very narrow window to get that, what we call the Goldilocks amount. And that's why your hair falls out, why you feel sick and you throw up and that sort of thing, because it gets all the other cells of your body. And often you'll get a reprieve from your cancer for a period of time, 6 months or a year, and then the cancer comes back. So it's not actually a cure. Our new therapy is we actually find a way to make the immune system, which all the time, every day of the year, is killing off cancers that appear spontaneously in your body. That's normal. And we actually activate the immune cells to go and find the cancer, the big cancer that you have, and kill it. And we give it special properties. So it's like your immune system, not like a vaccine, but like a supercharged immune system dealing with the cancer. And that's why there's no side effects.
So it's improving the capability of your immune system.
That's right. That's right.
Brilliant. Let me try and explain that. O lento tau whai ne wha mamla male se senga o tong fitinga mo tukane solo e ne le whai le kimo, le tau tato le kimo pēno whātoi o isi to ulu. A leo wha mamla o wha level tong fitinga na e iei me e tu tono le tino tangata ina ia watu ta pe si ama e whapitol kānisa. Alfa level e pepe maisi vaenga le leo tō tongo tangata. Mena le mo e mo side effect po si afianga o le tangata. E o i mo me o tatou whaktunga o ma me whapena. O le se senga la ma le tongo fitinga le whaila tō. O tono tatou tino le yele vaenga le tau le immune system po vaenga le te ea tuto ai ngā siama se ese me. E whaila tō le tongo fitinga le ina ia tu sa e whapopo le ngā ruenga po le sila fia po le malosi fo yo o le vaenga le o le so fo malolo ingo tangata. Ina ia mawhai ei o nā lusa o a so le siama lea, ta pēna o le siama na. Ai rea a fia isi vaenga o le tino pe o na ieli tu ai ngā tongo fitino la ini. Lona winga e te lea lea o ngā mo tātou. Pe a mo le tu ai ngā tongo fitinga le tono o New Zealand. That's good. I can't understand why we're not rushing and getting this out. If actually say your hair falling out and all the other side effects from the chemo, as we know it.
I suppose there's a history that the government, if you like, or the regulatory MedSafe are very concerned about any fancy new drug, and they have clever scientists shouting from the rooftops. They say, oh, a new expensive new drug. So there's a lot of controls to make sure that this drug really works and has got a health economic benefit as well. It doesn't cost more than what the country can afford. And so that's one of the very important things we're trying to do, make this therapy cheap enough that New Zealanders and the hospital system in New Zealand, the public health system, can afford it. And it's not just for very rich people.
I think the current government is looking at sort of doing something with Farm Act.
Yeah.
I've been following up with the train of repeal and all those things. So I wonder if they'd be looking at some efficient...
Well, if anything we can do to help wave our flag for us, you say, what about the Malaghan Institute? If you're talking to the politicians, you get onto it.
I want to interview some people and say, hey, there's an option here for us to look at. No, thank you. It's good to know that this is much better than the chemo from what I'm hearing. I guess for the question for the listeners will say, but when? Do you know roughly what would be a timeline? What would be a reasonable expectation?
I'm sorry because it sounds so long, but it's going to be very fast. We aim to finish within 2 years the most of our 60-patient phase 2 study. So in 2 years' time, we hope to be in a very strong position to be able to say, hey, this needs to start going into the public health system of New Zealand. We hope we can make things happen faster. We will do everything we can to put pressure on everyone to show that we have a good product, a good health treatment for cancer, and New Zealanders need it faster because people are dying all the time from this cancer.
Just to note as well that our particular treatment is for non-Hodgkin's lymphoma, particular type B-cell non-Hodgkin's lymphoma, but it's obviously that's what would be the first treatment off the care ranks. But obviously by going through this, we're wanting to bring in more treatments. We're looking, as Graham said, at solid tumours, at other blood cancers.
Solid tumour would be very good.
It would be really good because by doing this first set of trials, we're kind of setting up the system and making it very clear that it can be done here.
So we're very keen to not just go 2 years, 3 years, and then go to the next one, because that's 50 years before you get all the cancer treatments. What we're trying to do is put pressure on. We show this can work here in New Zealand this way, and then we try to bring a lot more in because a lot more will become available, and we have an organisation that will actually then be able to bring the other treatments for prostate cancer, for lung cancer, hopefully in a much faster time frame.
After 2 years, and that will leave just 1 year for the current government before the election.
Yes.
So if you come up with a nice positive thing, they want to hang on to something and they'll go to the election for...
Exactly. And we need all the voters out there saying, waving our flag.
We'll champion it from here.
Yes, exactly.
O le vaenga le tala no nei tu se mo le whawhanga le tunu. E lua tau sanga le wha moe e umai le whate le i trial po whatata inga le whaine i ono se furu i tangata le umana whiriwhiria e whai i ele tong fitinga le a la tau. A uma le lua tau sanga le ia o na mauti no lo le sila sanga i o iai. Ai e mautu la whono pe o na tala no ai. O le koleni fo ia fo mai mai ese tong fiti le na masani la to le fainga ese tong fitinga le tana no ni ta to le tiu ia to no ai o to wale le al misi e pe ye se fele to te le o inga senga se pe mo tong fitinga le i lo le tulanga le ni ta to le masani ai le ta o le kemo o le si vaenga le ta vai ai e ia I si tonga o mo me o kānesa le maua I le vaenga se so le tino le ta o la to le solid tumor ia po e mo me o le afo le prostate ia o isi to ngā kānesa o le ma me va pena o le fo le tam fa ye de ngata le va ai le kānesa le fa ye mo o yo tom tinga le fo ye kānesa o le toto ai ia mo ma kānesa o vaenga se so tino ia tato talo ina ia fa manu ia fo I tam fa ngala to ato no so ani mo so I fo malolo ina o tangata so I fo la langi nei ia fa na lango fo le malo o wala to tam fa ina ia so ani I le tulanga le mo na to Toi fatalo fatul fa fonga ngale tino o mato fatasi por fasala o ma Gail Marshall mai le fo I ma Professor Graham Gros mai le Malaghan Institute of Medical Research Tata noa tu inisio o lato research po o tamu whainga ina ia mau o ini tong fitinga mo ngase o kānesa ia manisi fo I o toa inga ngase o lo mau o tato tangata so I fua I lalulangi le ngati New Zealand lalulangi atoa o le sa mato tata none nisi vaenga leo tamu whainga e tamu whai ina ia I tonu la o tato tino le ia le vaenga le e te e atoa I wha mai ma ta pesi ama ese o le vaenga na lo tamu whai na to ina ia whai ima whai na whai e ni ngā ruenga e ta pe e toa I ngā siama ese le ma wai tato I ngase ma wha mai e le taimi nei ese mai lo o tonga fitinga masani pe o le kimo le ma tatanoa toa ia atonu mo tangata fo I e tato ia pe a masani a le kimo pe a wai alwaina ia ai whala vlave o isi o atu e tele a ia isi a fianga mawai o isi e le umina manuia ia e toe se sao mele ngā le kānisa ia na maari liuela ia le vava I nisto I ngā whainga fōu e soani I te toi fō maloloinga well, let's hope that after 2 years you will come back and then we'll say, yes, it's all proven. And then it'll be good to interview some of the 60 people,
yes.
You know, in your...
Actually, Gail may want to mention that we actually have patients who have survived their first trial. And they're wonderful people and they give you big hugs.
Yeah, that's been a really special thing for the scientists and support staff at the Institute because historically we've been in the labs and not had this direct contact with patients, and now getting to this stage of the trial we've been able to meet and hear the stories of the people that have benefited from it, and it's
and what it's meant for them and their families to have their life saved because they were on death's door.
How many went through the first?
There was
28 went through. A few did not make it because of the cancer was already too hard. But about 25 patients got through the phase 1.
And when we announced the results, we had a few of those patients speaking in the media, and they were pretty.
Wasn't a dry eye.
No, right. Yeah, that's pretty special.
Yeah, and they didn't lose their hair.
No.
So that would be the difference.
Yeah.
Oh, that's a good story. That's a very promising. I mean, you know, out of that number one, and because they've already had complications. And in any trial, I guess you'll find that. Yeah. Because people, some of them were too far.
Because the cancer is so fast and so aggressive, it's a very narrow window where they're actually available, especially at the end of chemotherapy. So
you're now looking at getting 60 people, or you already got part of the 60?
No, the whistle hasn't gone yet, but we're starting to recruit next year. We have to get a lot of things organised first, make sure we have all the teams who can make it reliably and going and have all the nurses and everyone sorted out so it's all organised. And we're also looking for funding at the moment. We're actually fundraising to make sure that we can actually do this trial.
Right. I'm quite sure some people out there with a lot of money, if you want to put it to a good cause, you've heard that they probably need some money too.
Absolutely.
So that will help them. So what other exciting projects are you guys working on? Are you...
there's a couple, and Gail can follow up with things I forget. First of all, there's a very strong program to make better vaccines to not just the COVID, but also to other diseases. There's we currently use attenuated live vaccines for certain things. They don't always work so well in some people, and we're very keen to make a messenger RNA version of those vaccines for people down here in the Pacific. So that's a very exciting program. We're also discovered a way to make a better malaria vaccine. Now, although malaria doesn't come to New Zealand, I don't know how far it comes down. We know as the climate warms, the chances of the mosquitoes that actually can bring the malaria get more and more in Auckland. So we need to start having a better vaccine for malaria. So we're working very hard on that. And I don't know if people out there suffering from inflammatory diseases like allergies and autoimmune diseases, we're making some major understanding about how the skin allergies start, etc. like that. And we're trying to work with a drug company to find if our knowledge can be translated into making a better drug for treating some of these skin diseases, which can be really hard for patients to live with, especially children.
Yes.
Children really suffer a lot from allergies and can affect their whole life in this very important school years. And people think, why are they so distracted? Why don't they study and stuff like that? But they're itching and scratching, or their stomach's itching and scratching. It's very hard for them.
So where are you with that research on the skin allergies?
It's very much at the research phase. We've known about allergies for 100 years, but it's been we know how to treat the symptoms, but now not how to stop the disease from starting in the little kids.
Because they always say it's the food that you eat that causes all these things. And of course your immune system should also try.
Exactly. There's a lot of things that's said about what causes this, and we've been working quickly through as many as we can, and we've got it down. And now there's very new treatments available, but we don't know how to use them. So our knowledge helps guide these clinicians and these drug companies how to use these new treatments which have been made to target certain hormones in our skin.
Right.
I think a really nice way to think about the research we're doing, which is all around the immune system, is you talked before about with cancer and turning it up to target cancer.
Yeah.
But the other work we're doing with allergic inflammatory diseases is about dialing it down, dampening the immune response, because sometimes it responds in a way that it shouldn't or overreact.
Yes.
So it's a really nice way to think of a bit of a dial, and our work being at both ends of the dial and having control.
So we know there's a number of people out there with gout, which is the immune system overreacting to these things and these crystals, and it can be very hard for some people. And knowing how to turn down the immune system in that setting is really important. See, this is why we have the comms person. They're better at the scientist explaining.
So in terms of gout, is it the dial down or up?
The patients, the people with gout, they have a dialed up immune system. We've got to pull it back a bit in a very specific way. So very specific cell types. It's linked with the diet. It's linked with the way you live, but it's so. A very specific targeting of a certain part of the immune system can help.
We have a few people with gout in the community.
They're
probably listening now and say, what are they talking about dialing up? This is very up there. It should be brought down here.
It's overreacting.
Yeah. So it's the immune system overreacting. That's what it is.
That's the part of the problem, yes. These things come out of solution, and the immune system sees this kind of death and danger and then starts attacking. That's why your toe gets big and red, and we know it can be very painful. Yeah. My mum has gout, and she does not like it. It makes her very unhappy.
Probably wondering, what are you doing?
Exactly. I get the.
Yeah. Oh, I'm quite sure. Let's hope that you come up with some solution to the gout, because it will actually help a lot of people. With that, the Pacific Island people, they love their fish, the seashells, and all that. And apparently, that's the one that actually get the body, the uric acid go up.
So, things fall out.
So it's how you manage that uric acid, I guess.
Yeah, but it's a complicated disease. There's a lot of research around it. It's a mixture of the diet, but also the way you handle the different diet and the different people's genes and that sort of thing, and then the way the immune system reacts to this crystals that are coming out as well.
So in layman's terms, the immune system sends something to fix what they see, and then you end up with this big toe and that. So that's how it works.
It's called a tophi. They're quite awful things.
Nā tō whaafonga mai, o le singa ngasi leo lo wawai, o le kaut po le ngungu. O le tau ai fo se awala fa stong fitinga I waipe e ala na tupu le melia. E wa ia tulola la fia o ia o le ngaluenga le immune system. E ave ia fo ia uri ia o tu tongo fiti. O le te lela lata o la to le overreact. O te lele ngaluenga faina leina na fulo le vai mo me fa pena. Ai ese awala e tau fai e la to ina ia awole te le os fa inga le avatu I le vainga na. Atonu le afia le afaina te le tato. ia tato talo ia ia most tong fitinga le mo le foi vaenga nga ia iluma with latu suenga. So we hear that you're a charitable organization just like us.
Yeah.
We rely on donations from our community and people that
We have to sing for our supper, don't we?
Yes, of course we do all the time. But with your work, it actually saves a lot of lives.
Mm-hmm.
You know, if you come with a better treatment. So I think it's a good cause for people to actually look at whatever money they can give.
Yeah.
They can help because I like what I'm hearing. That's why I like talking to you about your organization. You're looking at something that can actually, it's affordable for our community and can actually do a better treatment than what's there already.
Yeah.
So that's a good, plus for me. So hopefully that you'll be succeeding in getting in the government. The new government can also help out. Like I said, after the 2 years, they will be looking at something positive in the third year.
Yeah.
So by then your trial will be finished.
Yes.
And then you say, by the way, we're there now, give us the money to finish this year.
Finish the job. Yeah.
So we want the money now.
But what you say is very true. We are a charity, but in a way, it's really good to be a charity because you really engage with the community. We know where the money comes from, we know what people want, and we then try to give back to the community. Most of the staff are young people. They want to come. They've got that sort of missionary zeal that they want to, and it's really important part of our culture, of a science culture in an independent medical research institute like ours, driven by the fact that people want to do better by these young people. And it's just wonderful to have young people as the major part of our program.
We probably have listeners wondering, how do we make a donation? But there'll be something on your website?
Gail? Yeah, just head to our website, which is malaghan.org.nz, and it's donate button on the page. But also, section on the CAR T cell therapy if people want to find out more, and you can sign up to our newsletter if you want to get updates. So there's lots of good things to find on the website.
And I want to make a message too to those people who can't give for whatever reason. There's tough. They've got tough family circumstances. I always say, just tell 10 people about the Malaghan Institute and its work. Telling 10 people is just as powerful, and that spreads the word, and they'll find someone who really is in a situation they can give money, and then they can support what's really a wonderful New Zealand and Pacific organisation.
No, I like that. O le vaenga le matatano e nei I lunga le upenga sota inga le Malaghan Institute se I whailoa fo il tatonga le wenga. E peo na tonga mai, o whala mtonga whape nei, o le taunga whai e so e tonga fitinga mo tatou. Ia o lo whalangolango I tupe maua o na tautai peo tatou e le o whatupe tele le malo, se ilonga vanga na umana on malo se ngā wenga na whaile e maa matua le tupe. Ai wa e to lo le ia e le ngata o le malo le la talate our company titili yele fa yamo me o vaila au ma fatau le lalulang ia o tulanga na ye o mesidi o le yele tato fala tonga nei New Zealand tangata New Zealand scientist New Zealand o lo nga lulu e vaenga le i o la tona to mai o le fa nga e fa ye tato nga lu all the best Graham and Gail, sorry for the work that you're doing, and with this year we're just going through, and then you're very lucky. You have your immune system must be very good. You haven't been caught up by the COVID. Everybody else has.
Or maybe I didn't notice I had COVID. That's the other thing, and I didn't test. But no, it's been really good. Hey, final comments?
Yeah, final comments.
Hey, Gail, do you want to go?
Yeah, no, just great to be here, and wasn't expecting to be put into this, but good to be in the hot seat with Graham.
Thank you for joining us. Graham, thank you for the work.
Yeah, I just want to say to everyone, really, Merry Christmas. Love to everyone. I think it's really important. We've got to keep our society together and our community together, and the Malaghan Institute and the researchers want to be part of that community. And we look forward to a new year. We always can make it a better year and help people be better people if you see them being a bit funny.
It'll be much better after 2 years.
Yes. And we're working for you. I'll say that.
Yeah, thank you and all the best. And for your organization and your staff and yourself and your team, all the best for this season of festivities, and then we'll get back here next year and continue the good work to inform our community about what's happening at Malaghan. O le tato por kalame na whafonga le tunu pil tata noi ia o le ia vaenga ia pe unto mau mai lo tau sanga lumana ia to no to o mana fai le si vaenga le o trials e ono sful tangata o lo o fa moi e se temi lumana i ona mai le o le o ia inga mo mia mo ila tau fo yo lo mo le kanisa fa pe to te fi awai le fo i le tongtinga ia mo susu enga ia na tu ele lo ngo e isi la to susu enga le na fai mo le na ta wan le la e los fu valtanga tana fai susu enga malo lo si to te la to le na ia o si wat ia u tenge u tu nga tele le a fo nga sengasi an mena le mo wai ia fo vaenga ia le fo vatu fa mo nyanga kisi masima ia la o nei mo tato au fa fonga e fa pena fo na vatu i fa mo nyanga ia mo kisi masi ai to e mo la no tal tal no na to sang fo ia temne to fa so fo